You handle a lot of misdiagnosis of cancer cases. How is it that a doctor can be held at fault or responsible if someone gets cancer?
There are two things that a doctor is responsible in a cancer context. The first is to make a diagnosis of cancer, and secondly, and perhaps more importantly, is a timely diagnosis of that cancer. And here's why. Imagine inside your body a cancer cell is growing. It's like a time bomb in that as that cancer cell multiplies, it's getting to a breaking point where if that time bomb goes off, we have a situation called metastasis. And that's just a fancy word for meaning that the cancer has now broken out of that shell and is spreading sometimes wildly through your body. When that happens, your organs are at risk and your entire system is at risk.
Well, what are some of the ways that a doctor can determine if someone actually has cancer?
Well, there are typically three ways in which cancer is discovered. First way is perhaps the most obvious, and that is noticing a lump on yourself. You can do that as you're preparing for work in the morning, taking a shower. Also, that happens at a doctor's office during a routine physical examination. The second way is through radiological studies, and that's just a fancy word of saying X-rays or MRIs or CT scans, CAT scans. What the films will then show is that there is some type of change going on in your system. Typically, we see that in a breast cancer case. We see that the mammograms that a woman gets, which should happen yearly depending on your age, will show a darkening or a dense mass within that study, and that is a signal to the radiologist that something is going wrong. Thirdly is through a blood test. The blood screening these days is very sophisticated, and you can see changes in your blood levels, either high or low, that will tell your doctor that something again is wrong.
Well, how can you tell if the cancer would have been caught, then the person would have been cured? I mean, that's what an injury suit is all about, right?
Exactly, and that is the toughest part of a medical malpractice case involving cancer. We rely upon expert testimony, and the expert that you have in that situation is an oncologist. An oncologist is a doctor who has dedicated his or her life to the study of cancerous growth. Now, that growth can be predicted in terms of when that breaking point that we talked about earlier would occur. So, in any medical malpractice case, you rely upon your experts. In cancer cases, you need the testimony of someone who is expert, someone who is experienced, and someone who can tell a jury why that important early detection was necessary in that case.
For a free confidential consultation with one of our experienced injury attorneys, call our toll-free number or fill out a quick contact form today.